Every 30 seconds, somewhere on Earth, a person dies from cirrhosis of the liver. Before this video ends, dozens of families will lose a loved one to a disease many of them never even knew existed. That single brutal fact is both a warning and an opportunity. A warning because cirrhosis is frighteningly common, and an opportunity because knowledge, shared in time, can block the path that leads to those needless deaths. Cirrhosis is not an overnight killer. It is a silent, methodical destroyer that can lurk in an otherwise healthy body for years, whispering vague complaints, until one day the damage is so advanced that the liver's best tricks for self-repair no longer work. By then, the most powerful detox machine in your body, the organ that filters every sip of soda, every pain pill, and every slice of pizza, may be scarred beyond rescue. To understand why cirrhosis is so sneaky, picture your liver as a soft, flexible sponge. Each tiny air pocket in that sponge is a liver cell, and its job is to pull harmful chemicals out of your blood, turn food into fuel, and store vitamins for future emergencies. When a handful of those cells get injured, say after a weekend of heavy drinking or a short course of harsh medication, the liver's built-in repair crew rushes in. They patch the wounded spots with a thin layer of collagen, the same material that toughens scars on your skin. That quick bandage is called fibrosis, and by itself it is not a crisis. The real trouble begins when injury becomes routine, when the liver is exposed to toxic hits week after week, month after month. Each new assault lays down another collagen sheet, and eventually those sheets weave together into thick walls that squeeze healthy cells and choke off the sponge's natural flexibility. Doctors call that end-stage scarring cirrhosis. Once enough walls go up, blood struggles to pass through, toxins escape into the wider body, and simple tasks like controlling hormones or storing energy become life-threatening challenges. What makes the disease even more dangerous is that the liver has almost no pain-sensing nerves, so it rarely screams for help. Instead, it sends out soft warnings that are easy to brush aside. The first is often relentless fatigue. You wake up tired, feel winded after climbing a single flight of stairs, and find yourself dozing off at your desk long before lunch. Because fatigue can come from late nights, stress, or low iron, many people shrug it off. The second red flag is unexplained weight loss. Meals taste bland, your appetite dips, and the scale creeps downward even though you are not trying to diet. Beneath that weight loss hides a serious problem. Damaged liver cells cannot turn protein into muscle, so the body starts cannibalizing its own tissues for fuel. A few weeks or months later, swelling appears. Shoes feel tight, leg veins pop, and the waistband on your jeans fits in the morning but digs painfully by evening. In advanced cases, fluid leaks into the belly, a condition called ascites, causing the abdomen to balloon like a drum while arms and legs grow thin. Many dismiss that belly growth as ordinary fat or middle-age spread, but ascites fluid can fill with bacteria and spark infections that kill in days if not treated quickly. At the same time, bathroom clues begin to emerge. Urine turns dark like strong tea, and stools lose their healthy brown color and slide toward gray or white. That odd color shift means bile pigments, which normally give stools their color, cannot reach the intestines. When bile backs up, it also seeps into the bloodstream, tinting the skin and whites of the eyes, a yellow hue called jaundice. While some people see jaundice in the mirror, others notice it first in photos. Friends point out that their eyes look off under bright light. Itching soon follows, usually worst at night and often resistant to every moisturizer in the medicine cabinet. That itch is caused by bile acids trapped beneath the skin, irritating tiny nerves. Even scratches that draw blood bring no relief, and restless nights only feed the spiral of exhaustion. As cirrhosis advances, new symptoms expose the liver's central role in the body's chemistry lab. Because it can no longer manufacture clotting proteins, the tiniest bump leaves large purple bruises, gums bleed after gentle brushing, and spontaneous nosebleeds become common. Hormones drift out of balance. Men might notice swelling breast tissue or loss of body hair, while women may experience irregular or absent menstrual cycles. One of the most frightening developments is hepatic encephalopathy, a fancy term for brain fog triggered by ammonia, an ordinary byproduct of protein digestion, that slips past scarred liver tissue and floods the brain. Those affected lose focus, forget appointments, stumble over words, or feel drunk without a drop of alcohol. Loved ones may call it simple senior moments, but untreated encephalopathy can progress to confusion, personality changes, and even coma. The skin and hands provide further silent alarms. In daylight, palms may appear warm and bright red, a condition called palmar erythema. Tiny spiderweb veins sometimes spread across the nose and cheeks as blocked blood searches for new paths back to the heart. None of these signs hurt outright, but together they sketch a clear picture for any doctor who knows where to look. Sadly, surveys show that up to 40% of cirrhosis patients, nearly half, reach the hospital with little or no awareness of earlier warnings. A landmark 2023 Lancet study confirmed that many arrived only after serious complications like bursting esophageal veins or fluid-soaked lungs forced an emergency visit. Why are so many livers pushed to this edge? For decades, alcohol wore the crown as public enemy number one, and it remains a heavyweight threat. Research from Johns Hopkins reveals that men who drink more than 3 United Kingdom units per day, roughly 2 pints of beer or 3 small glasses of wine, for 10 straight years increase their cirrhosis risk 5-fold. Women need even less alcohol for similar harm because their bodies process ethanol differently. Yet alcohol no longer stands alone. Viral hepatitis B and C, once thought to be illnesses of other continents, now infect millions worldwide, often without obvious symptoms for decades. Even when modern antiviral drugs cure hepatitis C, the scarring they leave behind can continue to worsen if patients slip back into high-risk habits like heavy drinking or fatty diets. The fastest-growing culprit, however, is non-alcoholic fatty liver disease, NAFLD. Fueled by obesity, sugary drinks, and type 2 diabetes, NAFLD silently fattens liver cells until they rupture, inciting inflammation and fresh scar tissue. A 2022 German study discovered that 1 in 4 adults with poorly controlled diabetes already carried advanced fibrosis, yet felt perfectly well. Add autoimmune hepatitis, long-term use of certain medications such as methotrexate or amiodarone, chronic exposure to industrial toxins, and rare genetic conditions like Wilson's disease, where copper overloads the liver. And you see why cirrhosis refuses to belong to any single age group, nationality, or lifestyle. What makes cirrhosis more than just a local organ issue is the chain reaction it sparks. Scar-blocked vessels raise pressure in the portal vein, the main highway bringing nutrient-rich blood from the gut. That pressure inflates fragile veins in the esophagus and stomach, creating varices that can rupture without warning. A single bleed can fill the stomach with blood and drop blood pressure so fast that even ambulance crews race the clock. Roughly half of patients who suffer a major variceal bleed die within weeks if they never received preemptive treatment, making regular endoscopies a literal lifesaver for anyone known to have cirrhosis. Meanwhile, the same scars that block blood also hamper cell repair. Each attempt a liver cell makes to divide and patch a wound heightens the chance of DNA errors, and every error raises the risk of hepatocellular carcinoma, the most common form of liver cancer. Even those who quit drinking or clear hepatitis cannot fully escape that shadow. About 3% of cirrhotic patients develop liver cancer every year regardless of improvements. If all this sounds grim, remember the other side of the statistic. Cirrhosis steals a life every 30 seconds, but countless lives could be spared if the disease were caught before final collapse. That is why modern guidelines push for aggressive screening. Simple blood calculations, AST to platelet ratio index, APRI, and fibrosis-4, FIB-4, flag abnormal enzyme ratios long before an ultrasound shows scarring. Transient elastography, better known by the brand name FibroScan, offers a painless 5-minute test that sends harmless sound waves through the liver and reports stiffness on a scale from F0, healthy, to F4, cirrhosis. Early intervention works because the liver is astonishingly resilient. Remove the source of injury, and healthy cells can multiply, swelling sprouting blood vessels and even shrinking mild scars. But time is the key ingredient. Delays let collagen walls thicken, blood flow detours harden, and complications gain ground. The final piece of the puzzle is lifestyle synergy. The liver does not live in isolation. High blood pressure, clogged arteries, insulin resistance, and poor sleep all pour gasoline on its fires. Any action plan against cirrhosis must also fight sugary sodas, processed snacks, couch-bound days, and restless nights. That may sound overwhelming, but here is the empowering truth. Small, steady changes accumulate like compound interest in a savings account. Swap one sugary drink for water today. Take a 10-minute walk after dinner tomorrow. Ask your doctor for a liver panel at your next checkup. Each step narrows the deadly 30-second gap. Stay with me, because the next part of this video transforms fear into a clear, proven roadmap for healing. Your liver may bruise easily, but it also forgives quickly when given the chance. Together, let's open that door. Your healing journey starts with clarity, so the very first step is to collect solid numbers that show where you stand today and create a baseline you can watch improve over time. Ask your doctor for a full liver panel, ALT, AST, alkaline phosphatase, bilirubin, albumin, and a platelet count. Then book an ultrasound or CT scan to map the organ's shape. If possible, insist on a quick, painless fibroscan or MRI elastography. These 5-minute tests read liver stiffness on a scale of F0 to F4, and knowing your exact stage turns vague worry into a concrete action plan. Once the grade is clear, the single most powerful move is removing the cause of damage. If alcohol sneaks into your day, total abstinence is non-negotiable. Scandinavian research shows quitting doubles 5-year survival, even for long-time heavy drinkers, and support groups or medically supervised detox make that leap safer and smoother. If chronic hepatitis B or C lurks in your blood, modern antiviral pills can suppress or even cure the infection in weeks, slashing the scarring rate and cutting liver cancer risk in half. For the millions living with fatty liver driven by sugar, processed carbs, and type 2 diabetes, weight loss of just 7% melts fat from liver cells, and a Mediterranean-style plate packed with vegetables, whole grains, and olive oil adds anti-inflammatory nutrients while keeping you full. 2 cups of plain black coffee per day, confirmed in a 2022 randomized trial, stiffen the defenses further by boosting antioxidant enzymes. Next, give your recovering liver the daily tools it needs. Aim for 150 minutes of brisk walking or cycling each week. Little chunks of 10 minutes count. And sprinkle in 2 gentle strength sessions to build muscle that steals excess glucose from the bloodstream. Sleep at least 7 hours to regulate insulin, and drink plenty of water so blood flows smoothly through rebuilding tissue. Switch flavored sodas for unsweetened tea or lemon water. Season meals with herbs instead of salt, until your daily sodium stays under 2 grams. And keep protein moderate but steady so your body can rebuild without flooding the blood with ammonia. Medications used wisely form a second shield. Diuretics such as spironolactone and furosemide pull excess fluid from ankles and belly. Non-selective beta blockers like propranolol drop portal vein pressure, cutting the odds of a deadly variceal bleed in half. Lactulose traps ammonia so the colon flushes it out before it clouds the brain. And rifaximin keeps toxin-making bacteria from repopulating the gut. Review every prescription and over-the-counter pill for hidden acetaminophen, because more than 2 grams in 24 hours can push a scarred liver toward failure. Ask your pharmacist to flag duplicates. Vaccines are silent bodyguards, so update your hepatitis A and B shots if you are not immune already and get annual flu and pneumococcal boosters. Common infections in a cirrhotic body can snowball into sepsis far faster than in a healthy one. If complications refuse to calm down, modern procedures offer rescue paths. Tips: a tiny shunt threaded through a neck vein reroutes blood flow around scarred tissue to relieve ascites and lower bleeding risk. And when damage outpaces every repair tactic, early evaluation for liver transplant raises survival dramatically. Current data show 85% of recipients thriving 5 years after surgery, especially those listed before emergency decline. Do not overlook the mind, because stress hormones slam the liver as hard as junk food. Mindfulness apps, gentle yoga, prayer, or simply chatting with a trusted friend can drop cortisol, steady blood sugar, and make healthy choices easier tomorrow. Peer support networks work wonders too. A 2023 University of Michigan trial found cirrhosis patients who joined weekly video check-ins stuck to sobriety and medication schedules 30% better than those who tried to go it alone. While you build this circle, keep one eye on unproven shortcuts. Detox teas, miracle turmeric blends, and megadose vitamins may promise a clean sweep, but no supplement can erase scar tissue. Overnight, and several herbal mixes contain undisclosed metals that strain the very organ you are trying to heal. Always clear new products with a hepatologist and demand third-party lab results before swallowing a single capsule. At home, set up simple cues that steer you toward success. Keep a reusable water bottle within arm's reach. Log daily steps with a phone app. Stock your fridge with chopped vegetables at eye level. And store indulgent snacks on a high shelf so you must decide deliberately before grabbing them. Each tiny friction point nudges the brain to pick the healthier option by default. Record wins. 2. Watch stubborn enzymes fall on follow-up labs. Celebrate the day your waistband loosens because fluid is gone. Note the morning you wake clear-headed because ammonia levels finally settled. These victories feed motivation better than fear ever could. As your numbers improve, your doctor may taper diuretics or medical doses, but never drop surveillance. Book an ultrasound plus alpha-fetoprotein test every 6 months to catch liver cancer early, and schedule an endoscopy at intervals your gastroenterologist suggests, because banding fragile varices before they rupture beats emergency transfusions every time. If new symptoms appear, sudden confusion, rapid belly swelling, black tarry stools, treat them as medical emergencies and head to the hospital at once. Remember that the liver is famously resilient. Remove toxins, supply nutrients, and it can regrow healthy tissue in mere weeks. Yet resilience is not permission to relapse. Every return to heavy drinking, unchecked blood sugar, or high-salt takeout gives scar tissue a fresh foothold. Picture your liver cells as construction crews waiting behind a safety fence. Every smart choice lowers that fence a little, lets more workers in, and lays down new bricks of living, breathing tissue. When doubts surface, recall that people who catch cirrhosis before end stage and follow a structured plan often freeze progression for decades, and some even roll fibrosis back from F3 to F2 or F1. Let that truth ignite hope. Post the word "renew" somewhere you will see it daily, on a mirror, phone lock screen, or fridge door, to remind yourself why this mission matters. Then share your story online to encourage the next person standing where you once stood. The ripple effect turns individual healing into community change, slashing the grim statistic that opened this video, one informed decision at a time. So book the labs, clear the fridge, lace the shoes, lean on friends, question shortcuts, and keep your follow-ups. Your liver and your future self are already thanking you.